Okay, let's start the video. In this video, we are going to talk about in temperature control. Make sure to watch until the end because I will give you some tips and tricks that you need to remember. And also this video is going to be very fast because I have a lot of things to say. So if you don't like fast videos, then stop watching now and go and find another video to watch. But if you're ready, let's get started. The first thing that you need to know is how the body normally maintains its temperature. The normal temperature for the human body is 98.6 degrees Fahrenheit or 37 degrees Celsius. The normal range is between 97 and 99 degrees Fahrenheit or 36.1 to 37.5 Celsius. Our body gets rid of excess heat through two mechanisms. The first one is radiation. It is the transfer of heat from one object to another without direct contact. For example, when you are in bed and you feel the warmth from your partner, that is radiation. The second mechanism is convection. That is the transfer of heat through the circulation of fluids, most commonly air or water. For example, when you are outside and the wind blows against your skin, that is convection. Now let's talk about the different types of thermometers. There are three main types of thermometers that you will encounter as a nurse. The first one is the oral or the tongue thermometer. It is the thermometer that you use when you put it under the patient's tongue. The second one is the tympanic thermometer. It is the thermometer that you use to measure the temperature of the ear. This thermometer is great to use in infants and children. The third one is the temporal artery thermometer. It is the thermometer that you use to measure the temperature of the forehead. This thermometer is great to use in patients who are unconscious or cannot cooperate. Make sure to use the appropriate thermometer for the right patient population. Now let's talk about the different ways that you can implement in temperature control. You have three options. The first one is a heating blanket. It is the safest option, but it is also the slowest option. You need to apply a heating blanket per facility protocol. Most facilities will require you to apply a protective pad between the patient's skin and the blanket. The second option is a hot water bottle. You need to apply a towel over the hot water bottle to prevent burns. The third option is a warm bath or shower. Before giving a warm bath or shower, make sure to assess the patient for any skin conditions, especially if the patient has impaired skin integrity. The next thing that you need to know is when to call the provider. You need to call the provider and report a new temperature reading if it is below 36.1 degrees Celsius or 97 degrees Fahrenheit. Also, you need to call the provider if the patient is older than 65 years of age and has a temperature reading of 102 degrees Fahrenheit or 38.9 degrees Celsius. Now let's talk about hypothermia. Hypothermia is a core body temperature of less than 95 degrees Fahrenheit or 35 degrees Celsius. The causes of hypothermia include a decreased intake of warm fluids, exposure to cold environments, and an increase in insensible water loss, such as when a patient has a fever. The signs and symptoms of hypothermia include shivering, cold, pale, dry skin, tachycardia, tachypnea, hypertension, and decreased urine output. The priority nursing intervention for a patient who is experiencing hypothermia is to increase the core body temperature slowly. You want to prevent the patient from going into shock. You need to warm the patient gradually by using a heating blanket or warm water bottles. You also need to monitor the patient closely for the signs and symptoms of shock, such as hypertension, decreased urine output, and increased lactate levels. Now let's talk about hypothermia. Hypothermia is a core body temperature of more than 104 degrees Fahrenheit or 40 degrees Celsius. The causes of hypothermia include an increase in environmental temperature, infection, metabolic disorders, and drug reactions. The signs and symptoms of hypothermia include hot, red, dry skin, tachycardia, tachypnea, hyperglycemia, and increased urine output. The priority nursing intervention for a patient who is experiencing hypothermia is to decrease the core body temperature slowly. You want to prevent the patient from going into shock. You need to cool the patient gradually by using a cooling blanket or ice packs. You also need to monitor the patient closely for the signs and symptoms of shock, such as hypotension, decreased urine output, and increased lactate levels. The last thing that you need to know is how to answer the question, which is the priority nursing diagnosis for a patient who is experiencing hypothermia. The answer is not a nursing diagnosis. The priority nursing diagnosis for a patient who is experiencing hypothermia is not a nursing diagnosis. It is the medical diagnosis, which is hypothermia. As a nurse, your priority is to decrease the patient's core body temperature. Once the patient's core body temperature is back to normal, then you can start addressing the nursing diagnoses. And that's all you need to know about in temperature control. If you want me to make more videos like this one, please let me know. Thank you for watching and good luck with studying.